Hello, my name is Heidi O'Toole. I'm a licensed professional counselor and faculty member at West Virginia University in the Department of Counseling, Rehabilitation Counseling, and Counseling Psychology. My areas of expertise are both trauma and addiction. And as we are all well aware, we are in the midst of this opioid epidemic that has permeated every facet of our culture. It has permeated the medical profession, the mental health profession, and has unfortunately permeated every doorstep in our communities. That is why I'm here today to speak to you about Dr. Hardenberg's SAIL protocol for medical providers. SAIL protocol is an acronym for See, Assemble, Initiate, and Live. Seeing is the first portion of the protocol because we can't do anything about something we are unaware of. Seeing or observing our patients. She has developed a protocol that will help you observe through a lens that I look through as an addiction professional. We've got to give you another lens with which you can see the adverse effects, the symptomology of addiction, substance use disorder, what it looks like, sounds like, smells like, tastes like, feels like in the patient's lives. To observe through this lens will then help you assemble the skill set in with which you can assess accurately. Accurate assessments, as we know, directly influence our treatment protocols and suggestions. I'd like to just speak to you a little further on the assemble portion of the protocol to add what I believe to be clarity of where your responsibility begins and where it ends, where your responsibility ends and the patient's responsibility begins. So I'd like to add this concept to the assemble portion of the protocol, the concept of 2 and 4, just 2 little letters, 5 little words. I believe as providers, you are responsible to your patients and the treatment protocol. They are responsible for the outcome. So important that we have clear 2 and 4. We are responsible to our patients to provide treatment protocols. They are responsible for the outcome. With this clarity, there's motivation. 3 words I learned a long time ago. Clarity precedes motivation. The motivation then brings us right into the eye of the SAIL model, to initiate. If we have motivation, we can initiate change. Change perhaps in our prescribing protocols. Change in how we perceive addiction. Change in what our role is to our patients that have substance use disorders or addictive symptomologies. Change is difficult. If it wasn't difficult, we'd all do it. Change is also a process. And this model lends itself to initiate change in your current provider and or prescribing processes. Are you willing to change the process in order to provide a more proficient product? And if that's the case, if you're willing to participate in this process that Dr. Hardenberg's protocol is offering to you, then we have the opportunity to live rather than die. We have the opportunity to offer our patients, our communities, a chance to live free from the progressive nature of this disease. To live rather than die. Progressive, chronic, fatal. This protocol offers an opportunity to live free from the progressive nature of the disease. And that is why, without reservation, I endorse Dr. Hardenberg's SAIL protocol for medical providers.